Hi, welcome to Home Health Aid Orientation. My name is Ifi Ifemesia. This is Allen Healthcare Family. I am the Education Manager here at Allen Healthcare Services. Allen has been in business for over 30 years, providing superior care to our clients. Our clients consist of acutely and chronically ill clients with functional limitations. Patients' rights. Receive competent, individualized care and service. Expect that all personnel have been carefully screened and trained and be in good physical health. All aides are required to attend a 12-hour annual in-service, including annual mandatories. An annual field evaluation of every aide will be conducted to ensure competence. If there is a task that you do not feel that you are comfortable with, please contact the office for a review, supervision, or a retraining. All aides must complete their annual health assessment, a TB screening, and also a urinary drug screening in a timely manner. Never abandon the patient. If you must leave early, you must first receive clearance from the office. Arrive on time. Pain management. All patients should expect that their pain will be managed. If the patient has new worsening pain or medications and treatments are not effective, the aide should contact the clinical department to reassess the patient for pain management. Expect continuity of care by the same personnel. Replacement aids must be offered to the patient. Call-outs must be made in a timely manner to ensure the patient is offered a replacement. It is expected that the aides will demonstrate a commitment to their assignments. Access to the agency's 24 hours a day, 7 days a week. Allen Healthcare has an answering service and a nurse on call 24/7. Call the office at any time of the day to discuss patient issues or changes in the patient condition. The number is 718-657-2966. Expect that an RN will provide supervision of the plan of care. The aide must follow the written plan of care in the home. If you are unable to locate the plan of care in the home, or the patient is requesting tasks that are not listed in the plan of care, please contact the office as soon as possible and ask to speak to a registered nurse. Express complaints about the care and services provided or not provided. The patient has the right to lodge a complaint concerning their services to the agency, Department of Health, and Joint Commission. Privacy and confidentiality. Patients cannot be discussed outside of the patient's home, for example, in the elevators, to friends and family. Texting and emailing are not safe methods of communicating patient information. Never take pictures of the patient using your cell phone. Be treated with dignity, courtesy, consideration, and respect, and have their property treated with respect. Remember that you are in the patient's homes. Respect their homes. Ask where you can leave or place your personal belongings. Patient satisfaction is one of the utmost importance. Always speak professionally when speaking to the patient. And family, speak kindly and with respect to the patient. Avoid the use of cell phones unless it is in an emergency. Be sensitive to your patient's culture and traditions. Be informed of treatments, when and how services will be provided, the names and functions of employees providing care, including photo identifications. Always wear your photo ID. If it is lost, please contact the compliance department immediately. Reporting changes in the patient's condition. PACT. PACT is the personal aid care technology. Objectives. Why the introductory PACT training program was created. The home health aide is an important member of the Allen Health Care Services team. The importance of communication, observation skills, a key role of the home health aide. Reporting patient condition changes to the Allen nurse. Definitions. Communication. Communication is the process of sending and receiving information. There is a verbal communication, which is the use of words or sounds and can be written or spoken. Also, there is non-verbal communication, which is to communicate without using words. So like gestures, eye contact, those are non-verbal communications. Observe, observing, to watch and take notes. Early warning signs. Changes that occur in a patient's condition that may be an early sign of an illness. Why do we have the PACT program? We have the PACT program because healthcare is changing. The new role is to pay for quality rather than quantity. New York State has a goal to decrease hospital and emergency room visits by 25%. Home health aides can help by observing patient change in patient conditions, reporting this to the Allen nurse. The PACT program was created to meet this goal and to help improve patient and home health aide satisfaction. Why the PACT program? Our contracts are asking for results. They're asking for quality. Allen receives report cards that grade customer service, quality of service home health aides provide, hospital admissions, emergency room admissions and visits. The care and services you provide reflect Allen and will determine payment. So, quality affects us all. Observe and report. You have to know your patient very well and notice changes. And whenever you notice changes, you need to report. You have to look for things like physical changes. Are they speaking less than they used to before? Are they walking less than they used to walk before? Are they eating less than they used to eat before? Changes in behavior. Are they not remembering as much as before? Do they remember you today and then tomorrow they don't remember you? Are they loud? Are they being verbally abusive? What's going on? Activity level changes. Speech changes. Patient is not taking their medications or treatments. Changes you observe but find it very hard to describe. Maybe the patient tells you, I'm not feeling well today. What does that mean, I'm not feeling well today? You have to ask specifics and call the nurse. For examples, patient has not had a bowel movement for 48 hours. It's not eating or drinking well. A new or unrelieved pain, fever, dizziness. Also, things like patient is refusing to get out of bed. Those could be changes in behavior. Patient is depressed, confused, suddenly forgetful. Activity level changes. Patient was able to walk to the bathroom yesterday, but now had to stop 3 times to catch their breath. Patient seems more weak or fatigued. Any change that you notice and find hard to describe, again. See a patient condition change, call the Allen office nurse immediately. The number to contact clinical department is 718-657-2966 And New York City and Westchester is extension 1900. Nassau and Suffolk is extension 2901. The RN on call, which is after hours, after 5, and on the weekends and holiday, 347-907-9339. Remember, 911 should be called for emergencies like chest pain, heavy bleeding, and loss of consciousness. Patient falls. If patient falls, you call the Allen nurse. The nurse will decide what action should take next. When you work for Allen, you must wear your ID badge. For all other needs and issues, call the coordination department. Contact the coordination department for work, for scheduling, for complaints and incidents. Coordination department number 718-657-2966. For incidents and complaints such as patient injury, infestation, like bed bugs, rats, mice, roaches. If there's no heat in the home, no electricity, and patient has no food in the home. Alleged damage of patient property, safety hazards to the patient or employee, verbally physical abuse of employee, patient left the home without the aid, patient not home and aid clocked in as working. You call the coordination department. Remember, you are an important member of the Allen Healthcare System team. You are the eyes and ears of Allen. Look and listen for patient condition changes. Report those changes and falls to the Allen nurse. Contact the coordination department for everything else. Congratulations! You have completed the PACT introductory training. Together, we can deliver quality care and services. Now we're going to go to recognizing and reporting skin changes for the home health aide. Facts about skin. The skin is one of the largest organs in the body. The skin has 3 main functions. Number 1, protection. The primary function of the skin is to act as a barrier. The skin provides protection from injury and pressure, variations in temperature, infection, radiation, and chemicals. Number 2, regulation. The skin regulates the body temperature, sweat, hair, changes in circulation and fluid via sweat. It also acts to synthesize vitamin D. Number 3 function is sensation. The skin contains nerve cells that detect changes in the environment, whether you're hot or you're cold, touch and pain. Damage to these cells results in a loss of sensation, that is a loss of feeling. When sensation is lost, patients may not feel pain. When they have an injury, which may cause the injury to become worse. The elderly and diabetics frequently have loss of sensation, especially in their legs and feet. It is important for diabetics and the elderly to see a podiatrist at least once a year. An aide is never to cut the patient's nails. What happens to the skin when we age? As we age, collagen, elastin breaks down and the skin becomes less firm and elastic. Think of old rubber band that stretches. There is loss of oil glands, making the skin very dry. The skin injuries more easily and heals more slowly as we age. As a result, the elderly are prone to skin problems, ranging from itching, scaling, mild dryness, to conditions such as infections, ulcers. A severe skin infection in the elderly can be serious, even fatal. Note, the elderly may have poor vision, preventing them from detecting any changes to their skin. So here are some general skincare tips for the elderly. Avoid hot baths, frequent showers. Use mild soap and gentle apply moisturizers. The aides are not permitted to apply prescription creams or powders at any time. They have to quit smoking, use sunblock, keep hydrated, drink water if it's limited by the doctor. If it's not limited by the doctor, use a humidifier during the winter time. When skin changes are important to report to the RN. Check the color. If the color changes, red, blue, black, pale. The temperature, is it hot or cold? The texture of the skin, if the skin is swelling up, if there are bruises on the skin, rashes on the skin, if the skin has lacerations, injuries, burns, wounds, scratch marks, report to the RN immediately. Skin changes can be caused by injuries, infection, pressure on the skin, allergies, disease such as ringworm, psoriasis, atlas foot, gout, shingles, measles, or even bug bites, bed bugs, mosquitoes. Skin conditions may cause itching, burning, they may have pain, fatigue. Emotionally, the patient may feel shame, depressed, lose sleep, and have anxiety. When is it the best time to inspect the skin for changes? The best time to do this is during the personal care time when you're bathing or dressing the patient. What should the aide do when any skin changes is noticed? Immediately dial 718-657-2966 extension 1900 to speak to the RN during business hours. If it's after hours and holidays, on the weekends as well, you need to contact the on-call RN as soon as possible. Contact the RN in real time. Don't wait until the shift ends. The RN may need to ask you questions about what you have noticed. Be ready to describe the skin changes such as blisters, flat rash, raised rash, and symptoms like itching, pain. Encourage the patient to call their MD to make an appointment. How should the aide handle the skin changes? Certain skin changes can be contagious and spread infection. Always use standard precautions and contact precautions when a skin is exposed. Always wear gloves when it is possible for you to come in contact with the skin change. Use good hand washing technique. Remember to wash your hands before and after putting on gloves. Protect any area of your body that may accidentally touch the skin with an apron or a gown. Contacts come to the offices if you need additional supplies. Some skin changes, shingles, bruises, bug bite, leg ulcers, infection, pressure injuries. What causes pressure injuries? Pressure on a bony prominence such as the heel, the sacrum, shoulder restricts blood flow to the area, causing the skin to lose circulation and break down. There are different stages of a pressure injury. Stage 1. What you will see with a stage 1, there is no open wound on a stage 1. The skin may be red and painful. The skin does not blanch. It does not lose color briefly when you press your finger and remove it quickly. Skin temperature around it is often very warm. Stage 2. The stage 2, the skin breaks down, is open, or forms an ulcer, which is usually tender and painful. It may also look like a blister in stage 2. Stage 3, there may not be pain due to amount of tissue damage. If the ulcer progresses, there may be serious complications like an infection of the bone or blood. The ulcer extends into the tissue beneath the skin, forming a crater. Fat may show, but not muscle or bone. On stage 4, very deep. It reaches into the muscle and bone. You may be able to see the muscles, tendons, and bones. Pressure sores is suspected but cannot be confirmed. These are other types of pressure ulcers. A deep pressure sore cannot be confirmed. There isn't an open wound, but the tissue under the surface may be damaged. May look like a dark purple or blood blister. Unstageable pressure ulcer. In this type, the stage is not clear. Ulcer may be covered in brown tissue. There may be pus or a dressing. What should the aide do when he or she notices a pressure injury? Call the clinical department to speak to the nurse. The aide is not permitted to change or remove dressings. This must be done by the nurse or the family. Who is at risk for pressure injuries? The patient cannot respond to discomfort caused by pressure. For example, the patient that cannot communicate, lack of sensation limits the ability to feel pain. Moisture. If the patient has incontinence, sweating, skin not dried well after bathing, they are at risk. If the patient has limited activity, for example, if they are bed-bound, chair fast, walks very occasionally. If the mobility is poor, ability to change and control the body position, they are at risk. Poor nutrition, poor appetite, friction or shear. Patient is lifted in the bed or in the chair using a sheet, causing friction on the skin. This is usually seen in patients with spasticity, contractures, agitation, frequency slides down in the bed or chair. The best treatment for pressure injuries is prevention. Inspect the skin frequently with special attention to the bony prominences. Call the RN with any changes. Do not use foam mattresses. Regular foam does not distribute weight evenly and may make the ulcers worse. Every patient that has a risk of pressure injuries should have an air mattress. Call the RN and make the suggestion. They will be happy to hear from you. Avoid elevating the bed too much. Added elevation will cause more pressure on the sacrum. Note, patients that cannot swallow or on two feedings should never be flat in bed. This can cause them to choke. Relieve heel pressures by raising the heels off the bed with pillows. Suggest to the RN that heel pads should be ordered. Keep the patient dry. Check the diaper area frequently. Follow the bowel and bladder program if your RN has added that to the care plan. Dry the skin after bathing or sweating. Pay careful attention under the creases and folds of the skin. Use incontinence skin barriers. Maintain adequate nutrition. Protein is the building block of tissue. Encourage nutritional supplements. Call the RN for lack of appetite. Our aids make the difference. Allen is known by our business partners to employ quality aids. Remember, please call the RN if you notice any changes. Thank you for being a superior aid. Now we're going to talk about abuse and neglect. Definition: abuse. Abuse is physical, sexual, or psychological maltreatment or neglect of a child or an adult, especially by a caregiver. Abuse may include any act of failure to act by a caregiver that results in actual or potential harm to the patient and can occur in the home or in the organizations, schools, or within the community setting. This includes physical abuse, emotional abuse, financial neglect, lack of a suitable shelter, non-compliance with school, like for a child, or medical appointments, sexual abuse, limited caregiver skills, alcohol and drug abuse, domestic violence, insufficient food, financial exploitation, and abandonment of caregivers. Where does abuse occur? Most of the time, abuse tends to take place where the patient lives, most often in the home, where the abusers are. However, abuse can take place in any setting. It could be in the hospital, the nursing home, in the school, in the daycare centers, etc. Risk factors among caregivers: inability to cope with stress, when the caregivers are depressed, when they lack support, substance abuse, financial issues. Caregivers has a history of abuse. What are some of the signs and symptoms of abuse that you will notice? Unexplained signs of injury, such as bruises, welts, or scars. Broken bones, sprains, or dislocations that are unexplainable. Medication non-compliance. Caregivers' reluctance to have anyone see the patient alone. Threatenings, belittling, or controlling caregiver. verbal abuse, regressive behavior of the patient, bruises around breast or genital areas, unexplained vaginal or anal bleeding. Patient is always watchful as though preparing for something bad to happen. If there's an unusual weight loss, malnutrition, dehydration, untreated physical problems, for example, sores or wounds, unsanitary living conditions, lack of medical care, being left dirty or unbathed, unsuitable clothing for the weather. These are signs of abuse. Unsafe living conditions. For example, there's no heat, no running water, fire hazards, desertion or abandonment. Some of the signs of financial exploitation in the elderly. Significant withdrawals from bank accounts. Sudden changes in the financial condition of the patient. Items or cash missing from the home. Suspicious changes in wills, power of attorney, titles, and policies. Unpaid bills or lack of medical care, although the patient has enough money to pay for them. Unnecessary services, goods, or subscriptions. I once had a patient, all his bills were not being paid. The home health aide had to call me, and when I answered the phone, she said they're about to evict the patient. I spoke to the patient. He said he had a friend that paid his bills, but that his bills were not being paid. We found out that his friend was taking his money. We had to intervene immediately. Thanks to that superior Allen aide that called immediately. And we stepped in, and everything was resolved by the APS worker that went in there. So you see, it's very important to be very observant. Self-neglect. Adults who can no longer make safe decisions for themselves are reported to Adult Protective Services for legal guardianship. These patients may not be eating correctly, living in unsafe conditions, poor hygiene. APS will arrange for a psychiatric evaluation to determine the patient's decision-making capabilities. Signs of abuse in children. Sudden changes in behavior or school performance. Lack of adult supervision. Lack of medical care, for example. No immunizations, dental care, glasses. Overly compliant, passive, or withdrawn, may seem frightened by the caregiver. Consistently dirty, inappropriately dressed for the weather, distrusting of adults. Extremes in behavior, such as being overly compliant or demanding behavior. Extreme passivity or aggression. Lack of attachment to the parent. The child not attending school or is frequently absent. New York State law requires all children 7 and above to attend school regardless of cognitive abilities or medical condition. Children may receive home tutor. Domestic violence. Domestic violence is also considered an abuse. If the employee is in the home and there is an episode of domestic violence, the employee should be directed to leave the home and call 911 and the clinical department. The clinical department will make an ACS or APS report. Reporting abuse or neglect. If the patient is in danger 911 should be called immediately. If the patient is not in imminent danger, the clinical department should be contacted as soon as possible. If needed, the nurse will call in a report after discussing the issues with the caller. It is very important that any report of abuse or neglect is reported directly to the RN. Do not transfer the call to voicemail. Administration for Children's Services ACS number is 800-635-1522. Adult Protective Services APS number 212-971-2930. A referral for APS may also be made online. Now we're going to go to fall prevention. Falls are defined as any event which results in a person coming to rest inadvertently on the ground, floor, or lower level. If a patient is eased to the floor by an aide, this is considered a fall. All falls on or off service hours must be reported to the office. Instruct the client to use handrails. Remove clutter from hallways, walkways, on the floor. Report the clutter to the office. Suggest a non-skid thread to make the edge of the stairs, under area rugs, shower floors, and in bathtubs. Remove scattered rugs or use double-sided tape to keep rugs from slipping. Encourage the patient to have their vision checked annually. Encourage the client to improve the lighting in the house, because as clients get older, they need brighter lights to see well. Hang lightweight curtains or shades to reduce glare. Encourage the client to use night lights. Encourage the client to install grab bars in the bathroom. Suggest the client use a shower chair if there are issues with endurance and balance. Instruct the client to avoid using a step stool, because this is very dangerous. Clients should keep items that they use most often on the lower shelf so they can be able to reach it. Encourage well-fitted rubber-heeled shoes. Encourage well-fitted rubber-heeled shoes. Clients should avoid walking barefoot and wear shoes with backs. Electrical wires and cords should be placed behind furniture or along the walls. Wires should be taped or tacked down. Wipe up spills immediately. Remove slippery surfaces. Avoid overwaxing the floor. Encourage clients to use furniture with armrests for support. They should take their time when getting up or from lying down to sitting position. Remind them to use assistive devices such as cane, walker, and so on. Assist them with ambulation as needed. Encourage the client to inform their doctor of new medications, changes in gait or balance, any type of dizziness or seizure activity. Inform the clinical department of the same. Fall prevention. Clients should be encouraged to use transfer techniques as directed by the nurse. Speak to your nurse if you feel that the client needs equipment such as wheelchair, commode, walker, grab bars, helmet, shower chair, and so on. Speak to the patient about obtaining a personal emergency response system, that is a life alert if they leave alone. This is an alarm device that will bring help in case the client falls and cannot get up. Encourage the client to speak to their doctor about beginning a regular exercise program. Exercise helps to make the client stronger and improves balance and coordination. Now we're going to talk about infection control. The best way to prevent a spread of infection is by proper hand washing. Hands may be cleansed with hand sanitizer gel unless your hands are visibly dirty or the patient has TB, tuberculosis, diarrhea, or you have been specifically told by the nurse that you may wash your hands using soap and water only. The gel should be rubbed into the hands using friction until it's dry. Take about 20 to 30 seconds. Use of traditional soap and water. Take about 1 minute, start to finish. Time yourself by singing the happy birthday song. Sing it twice. Soap and lather hands using friction. Dry your hands well. Use a towel to turn off the faucet. When do you wash your hands? When you arrive in the patient's home and when you're about to leave the patient's home. Before you put on gloves, when changing gloves, and when removing gloves. Before, during, and after preparation of food. Before and after you touch the patient. After changing diapers, changing a patient that is incontinent or has used the toilet. After blowing your nose, coughing and sneezing. After touching an animal, animal food or animal wastes. After touching the garbage. Whenever hands are visibly soiled, you must wash your hands. Patient infections. You have to report all infections to the nurse in the clinical department. Symptoms of an infection include fever, drainage or pus, skin changes, cough, nasal congestion, urinary tract infection. If they are making frequent trips to the bathroom, burning when urination, foul smell of the urine. Standard precautions should be used with all patients. Employee infections. Employees should not report to work with any active communicable infection. Our patients are at an increased risk to develop an infection due to their illness. Do not place the patient at risk by reporting to work with an infection. Report all infections to the HR department. The employee should be without fever or sign of infection for 24 hours before returning to work. Flu prevention. To protect yourself and the patients that you care for, it is recommended that all healthcare workers receive the flu vaccine every year. It can take up to 2 weeks for the flu vaccine to become effective. The season extends from October through May. The vaccine may be obtained from mobile health, local pharmacies, Department of Health, or from your private physician If you do get sick, the vaccine can make the symptoms milder. Additional measures to protect oneself include proper cough etiquette, just like that, cough into the sleeve, and hand washing. Do not share food utensils and wash them thoroughly. Disinfect hard surfaces. The aide should not report to work with flu symptoms such as cough, sore throat, runny or stuffy nose, body aches, headache, chills, and fatigue. The flu is very contagious. You are able to infect other people before symptoms appear and up to 5 to 7 days after becoming sick. Some people carry the virus and never develop symptoms. People with the flu can spread the virus to others up to about 6 feet away. It can be spread by coughing, by sneezing, talking, and touching an infected surface. Flu compliance. During flu season, all aides are required to carry proof of vaccine with them at all times. Proof can be provided by a sticker that is available at all offices or by a letter from your doctor indicating the date of the vaccine. Any aide that has not received the flu vaccine or cannot produce proof of vaccine must wear a mask while caring for the patient. The mask must be thrown away if they become wet and when finished caring for the patient. Masks are not to be reused between patients. Masks can be obtained from all office sites. How can the aide help their patient during flu season? Our patients are chronically ill and are more susceptible to the flu virus. The aide is an important member of the healthcare system. The aide can assist the patient by assisting with scheduling MD appointments, reminding the patient to ask their doctor about the flu vaccine at their appointment, or by accompanying the patient to the local pharmacy to receive the vaccine. The aides are encouraged to call the clinical department at extension 1900 during business hours with any changes in the patient's condition, including symptoms of flu. Personal protective equipment, PPE. What is PPE? Personal protective equipment is specialized equipment or clothing you use to protect yourself and patients from germs. It creates a barrier between the germs and you. PPE includes gloves, gowns, goggles, masks, and eye shields. When to use gloves? Use gloves when your hands may become contaminated by blood or bodily fluids, mucous membranes, or non-intact open skin. Use gloves when touching items that may be soiled with blood or body fluids. Use gloves when your hands are dry, cracked, or when you have open areas and you will be in contact with the patient. Use gloves when preparing food for the patient. Gloves are single-use items. They should be put on immediately before an episode of patient contact or treatment and must be changed between different care or treatment activities for the same patient. When to use gowns. Use gown during activities that may cause soiling or generate splashes or bodily fluids or sprays of blood. Wear a disposable gown when there is risk that clothing may be exposed to bodily fluid or secretions. Wear a long sleeve gown if there is risk of extensive splashing of bodily fluids or secretions onto your skin or clothing. Gowns are also single-use items. They should be put on immediately before an episode of patient contact. When to use facial protection. Use a mask and eye protection for patient procedures that may cause coughing, splashes, or sprays of blood or bodily fluids. Use a mask and eye protection when you are within 6 feet of coughing or sneezing. Prescription or fashion eyewear is not considered PPE. Why use PPE? PPE protects you from contact with germs. Wearing a personal protective equipment, PPE, can reduce spread of germs to your family, friends, co-workers, and patients. Now we're going to talk about tuberculosis. What is tuberculosis? TB. TB is a caused by a bacteria, germ. It's spread from person to person through the air in invisible droplets when a person coughs or sneezes. It infects the lungs and sometimes other parts of the body. There are 2 forms of TB. TB infection, which is inactive, and TB disease, which is active. The inactive one is a person that has been infected, but they do not have the disease. They cannot spread TB to others. The TB that is active is people with the active disease. They are infectious and can spread the disease to others. Patient requires medical treatment. Symptoms of TB: persistent cough, coughing up blood, chest pain, night sweats, fever, loss of appetite, weight loss. Not every person has all these symptoms. Disease can be spread to others. How is TB transmitted or spread? TB is spread through the air from one person to another. The TB bacteria are put into the air when a person with TB coughs, speaks, or sings. People nearby may breathe in this bacteria and become infected. When is a person no longer infectious after they have had the disease? A sputum test called an AFB is given. The person must have 3 consecutive negative sputum tests collected on different days to be considered no longer infectious. What to do if your patient has these symptoms or has told you they have the disease? Call the office immediately and report it as soon as you find out or suspect it. Preventing blood-borne diseases. Sharp safety. HIV, hepatitis C, hepatitis B can be spread by exposure to blood and body fluids. Standard precautions should be followed for every single patient. Needle sticks can transmit blood-borne diseases. Be aware of the patient's needles and where they may be aware of the patient's needles and where they may have left them. Every patient must use sharps container. Place the container near the patient's reach. Sharps containers can be purchased at pharmacies or DME companies. Also, they can use a detergent bottle or thick plastic bottle may also be used. A bleach bottle. The bottle must be labeled sharps and can be thrown away with the regular garbage. They should not be placed with the recyclables. Hospitals also collect full containers. The container should be discarded when 3/4 full. Sharps may sometimes be found on side tables, couch, cushions, wrapped in tissues, on the kitchen counter, etc. If the patient is not using a sharp container, notify the nurse in the clinical department. Needle sticks. If an employee is stuck with a needle, wash your hands immediately with soap and water. Call the office and report the needle stick right away. You will be referred to an emergency room, an urgent care center, or your physician. Your doctor will draw the blood for a baseline HIV and hepatitis screening by the office. You may be placed on medications. You will need continued medical follow-up. This is considered a workman's comp injury and will not be charged to your insurance. The employee will need to take precautions such as practicing safe sex, not donating blood, and so on, until they are cleared by the physician. So it is very important that you avoid needle sticks. Emergency preparedness. Meteorological, such as blizzards, tornadoes, hailstorms, hurricane, and droughts. Topological, such as mudslides and floods, underground disasters, earthquakes. Biological, such as communicable diseases, epidemics, emerging pandemics. Also human-generated, such as terrorists, riots, transit strikes, accidents, electrical system failure, fire, chemical spill, explosion, nuclear leak. Type of emergency staff responsibility when there is a disaster. At times, some emergencies may be anticipated, for example, snowstorm, transit strike. Other emergencies may occur without knowledge, such as an earthquake or an act of terrorism. Emergencies may occur on weekends, holidays, and after hours. Employees who live in evacuation areas are to leave a forwarding number with their supervisor for communication purposes before evacuating. Staff must ensure that their phone numbers, address, and emergency contacts are always updated with their manager and HR department. Emergency preparedness. Goals of an emergency plan. The goal is maintain continuity of care to agency patients. Maintain the agency's ability to continue operations. Ensure patient and staff safety. Ensure patient and staff safety. Limit harm, reduce danger. Limit harm, reduce damage. Maintain staff cooperation. Ensure appropriate utilization of resources. Ensure an orderly response to emergent situations. Once the emergency plan is activated, staff will be notified. Allen has a telephone tree that is called a call down list in place to contact staff in the event of a disaster. It is important that your contact numbers are updated and current. All field employees are to call into the office for an assignment. All other employees are to report to the office unless otherwise informed that the office has been closed or the employee has a field assignment. Office closures will be made via a phone blast. If the employee is unable to report to the office, they must notify management and will be given an assignment. The Forest Hills office has been designated as the main office. Employees may be assigned to varied duties and or various offices, for example, contacting patients by telephone from an office closer to their home. Important notes: always keep your cell phone on and charged. Maintain contact with your supervisor. If contact is difficult, please email www.support@allenhealth.com. Keep your gas tank full. If you need to evacuate your home for any reason, please notify the office. Patient prioritization. Patients are reviewed to establish which patients must be serviced and which can retrieve a lesser degree of care or receive phone calls. Patients are reviewed to establish which patients must be serviced and which can receive a lesser degree of care or receive phone calls. Patients are classified as level 1, 2, or 3 on admission to the agency and when their condition changes. Patients are also classified on their ability to evacuate the home. Enables the agency to rapidly identify patients that are at risk. Patients roster. Current patient rosters will be generated and will identify the patient's contact information, priority level, TAL, emergency contact numbers. It is of the utmost importance that the changes in the patient's contact numbers and or demographics be reported to the office immediately. All patients must have emergency contact documented. Coordination of services. The coordination department will make every effort to assign employees to scheduled patients based on priority as the area is deemed safe for travel, to provide service to as many patients as possible. Coordination may reassign aides to areas close to their home or reduce service hours to accommodate patients. Patient caregiver education. Employees contacting the patient's emergency caregiver by telephone will review the following: adequate supply of food, water, medication, and medical supplies for 72 hours. Have a go bag ready with 2 to 3 days supply of all the above. All employees are strongly encouraged to also have a go bag ready themselves. Have flashlights, extra batteries, and telephones that do not need electricity. Develop an evacuation plan. Where to go and how to get there. Review the on-call number. All patients' issues are to be communicated to the employee's supervisor. All patients with life-sustaining equipment, for example, oxygen, GT feedings, etc., are strongly encouraged to report this to the electricity provider before an emergency occurs. Fire prevention. Keep the area free of waste paper, trash, and other items that can easily catch fire. Check on electric cords. If a cord is damaged in any way, it should be replaced. Try not to lay cords in places where they can be stepped on, as this will contribute to deterioration of the protective outside coating. Don't overload circuits. Turn off electrical appliances at the end of each day. Keep heat producing equipment away from anything that might burn. This includes toasters, coffee makers, and so on. Remind the patient of the importance of having smoke detectors and carbon monoxide detectors. Remind them to change the batteries twice yearly, maybe during the daylight savings time. In the event of a fire, upon finding a fire, call 911 immediately and don't hang up with the emergency responder until you are told to do so. Close doors when exiting to help limit the spread of smoke and fire throughout the building. Never use elevators during an evacuation. Always use the staircase. Follow the escape plan and meet at a predetermined place outside of the building and away from danger. If you are unable to escape, first, create a barrier between you and the fire. Do this by going into a room that is unaffected by the fire and shut the door. Then, stuff the gap under the door with a wet cloth and close the vents. By doing this, you can seal out the smoke and wait safely until help arrives. Don't break the windows. If you need air, open the window a crack. Stay under the smoke where the air is fresh. Keep a wet cloth over your nose and mouth and try to breathe only through your nose. Signal for help by hanging an easy-to-see object in the window. If you have a phone near, call 911 for help. RACE, R-A-C-E. R stands for rescue. If anyone in the area is in danger, that person needs to be removed from the area. A, alarm, call 911. C, confine, close the doors behind you as you leave the area to prevent the spread of fire. E, extinguish, evacuate. Be familiar with the use of fire extinguisher. PASS, that is the use of fire extinguisher. P stands for pull the pin in the handle. A, aim the nozzle on the base of the fire. S, squeeze the lever slowly. And S, sweep from side to side. To be used on small fires only. Evacuate the building. There ends the Home Health Aid Orientation Program.